I'm Jordan Peana from Subchondral Solutions. We're a surgical implant, kind of shaped like a thimble. It's a screw, but it's designed specifically for the repair and reconstruction of osteochondral lesions, bone marrow lesions, or cartilage lesions. It's super simple, reproducible technique and allows the patient to be able to weight bear and mobilize immediately, and the implant will proliferate a type 2 cartilage over the top of it. Ideally, our implant is designed for focal defects or localized arthritis, and it can also be used to treat some cystic lesions as well. So now you can decompress that diseased bone and stabilize that subchondral bone, which will allow the biology to happen. If you think about it like repairing a pothole or basically putting rebar into concrete, when you provide a nice mechanical environment, it allows the body to allow the biology to happen.